The latest twist around this variant has seen border closures for the southern African nations where this variant has been spreading. But already there have been concerns that this really amounts to some form of economic consequence now, because we're talking about nations where vaccine rates are very low, where there hasn't been the same distribution or access to those vaccines. Are you concerned about the economic implications for countries that don't have the same level of vaccines as developed nations?
Absolutely, I'm very concerned. First of all, I've said it time and again. Let's just take the numbers. We've had 7.8 billion doses of vaccines administered worldwide, which is great. We've been able to produce more vaccines than ever, and so that is commendable. But only 0.7% of this has gone to low-income countries, and for Africa, about 3% of these doses. So the level of inequity is quite high. And the work we have done, and the IMF also has done, has shown that recovery from this pandemic, economic recovery, is based on two things: the amount of fiscal stimulus that a country is able to administer, monetary policy easing, along with access to vaccines. Those are the two biggest determinants. In our trade work, we also found the same divergence between countries depending on access to vaccines and the fiscal stimulus. So I'm very concerned that if we continue with the inequity, that will have a dampening effect on recovery in those countries. And if you couple that with closure, not allowing those countries to travel or people to come in, I think that is really, that puts a dampening edge on recovery in many of the developing countries. And maybe the decision to immediately close down, one can understand it maybe politically, but I think it was a bit too hasty, and shut down on the 7 African countries when it wasn't clear whether the Omicron variant started in those countries. Now we found out that it was actually in Europe a week before it was discovered in South Africa. So there's also a level of feeling of unfairness in what was being done.
So just to be clear around these border closures now, as you point out, the variant has been seen in 24 countries, 5 continents. Are you saying the borders should be reopened with the southern African nations?
I'm saying that it should not have been closed so hastily until we had a bit more information on the Omicron variant, where it was coming from, what impact it would have. And as I said, it was discovered, it's been in Europe, even before the South African researchers put this out. So I think we ought to reflect carefully how we handle these types of information, because it serves as a disincentive. If you feel that you let out information and the immediate consequence is negative on your country, it gives pause. I think we should reflect on the actions we take. That's what I'm saying.
As you know, Dr. Ngozi, there are a lot of organizations that believe that there needs to be very rapid movement on the issue of patent waivers for these vaccines. And there are some WTO members that are still obstructing approval of a fulsome patent waiver. Is there any way that those conversations could be had virtually if it's necessary to see faster vaccination take place in the light of this new variant?
Absolutely, and I am absolutely in agreement that in light of this new variant, we really have to treat this with a sense of urgency. We must get an answer on the issue of the IP waiver. And work is continuing. It's been stuck for some time. I've said that very clearly. But I think there's a new sense of urgency, and the proponents and the non-proponents beginning to come together to have informal discussions on how to move this forward. It's happening both at the ambassadorial level here in Geneva, but also, like you said, we're trying to find creative ways virtually for ministers to meet from countries, some groups of countries that have opposing views, so that they can work together. I think, as you know, the WTO is a negotiating forum, so we can't have a situation in which there are two polarized sides. We have to bring them to the middle. So that's very much the work we're trying to do now, to find a way forward that could maybe not give everything that each side wants, but would be a satisfactory answer to the situation. So that's what we're working on. That work now is resuming, and everybody has a sense of urgency about it.